Good morning. This is Dr. Anthony Chang from AI Med, and we're going to be doing another AI Med talk. And this morning, good friend and colleague at the from the American College of Cardiology, Jimmy, and Jimmy is also a full professor of medicine and cardiology as well as informatics. So a dual role for Jimmy at Duke. So welcome to our talk, Jimmy.
Great. It's great to be here, Anthony. Thank you for having me on.
So as a fellow cardiologist, tell us what's been going on from your cardiologist perspective with COVID-19. What are you seeing and what are you worried about?
Wow, what a difficult time. This is a time that none of us have ever seen, and hopefully none of us will ever have to experience, but it really is a trying time. From a cardiology perspective, there are several different themes that have evolved out of the COVID-19 crisis. One is that COVID-19 is really a very protean disease, from the asymptomatic all the way through patients who present and are very, very desperately ill from diffuse inflammation and systemic thrombosis. That can lead to the cardiac manifestations that people fear, such as myocarditis leading to fulminant heart failure, ischemic expressions of coronary disease, such as myocardial infarction and acute coronary syndromes, and kind of everything in between. So part of what we've had to do within the field of cardiology is to make sure that everybody is educated as much as possible to anticipate, to expect that this particular problem, this particular disease could be expressed in many different ways.
Are you seeing some confusion in the clinical world about chest pain as well as infarction from COVID versus not related to COVID? How are you sorting that out?
Oh, yes. So if you look at the extreme end of the spectrum, the patient who presents with an ST elevation myocardial infarction, that actually creates the biggest dilemma for us because those patients really need to go straight away to the heart catheterization laboratory and get their artery open quickly if they're going to benefit from revascularization. So we've implemented in the emergency department a very quick screening process to identify whether or not a patient could be presenting with a COVID mimic, like an ST elevation MI. We even have the 15-minute swab, so that by the time the patient gets up to the cath lab, we actually have a result back, et cetera. Yeah, so a lot of systematic things to make sure that we're making the right decisions for the right patients.
Well, I think this pandemic, Jimmy, has demonstrated very clearly that data is still the absolutely critical foundational layer to any kind of data mining, data science, artificial intelligence work. So I'm a great admirer of your work in the data interoperability. Tell us what's going on in that area.
Yeah, so aside from my one hat that I put on and try to practice as a clinician, the place where I spent a fair amount of time trying to help support the COVID-19 crisis is to understand what information really should be captured as data in discrete, interoperable, semantically understandable ways from one location to another, so that we can actually aggregate data for machine learning purposes, for artificial intelligence application, et cetera, et cetera. Working with the American College of Cardiology, I've been working on a subset of information that's COVID-19 specific, reflecting, for example, some of the manifestations that we just mentioned, and specifically how to capture that information as data at the point of care. Now, that also requires a degree of standardization of those data elements, and so there's, even through, for example, HL7, there's a clinical information modeling initiative. So I've been very fortunately placed to help the HL7 SIMI group through a company, through an organization, it's not a company, through an organization called Logica Health, do the modeling, do the formal modeling, so that these concepts can be captured systematically as data in electronic health record systems, and then potentially brought together for aggregation purposes to really serve any need, from contact tracing to epidemiologic investigation to understanding the relationship of genomics to disease expression to, there's an interesting work that came out of the Los Alamos National Laboratory about the 14 different mutations that already exist, and whether or not one or more of those mutations are more virulent, potent, et cetera, than others. So if we can capture the information in a systematic way, then we have a much better chance of applying artificial intelligence to trying to figure out and perhaps even solve, or at least contribute to solving the problem of COVID-19.
Yeah. Well, viruses, I think, are pretty smart, so we're going to need all hands on deck in artificial intelligence. But all that relies on the foundational layer of data.
Yeah.
And we're very excited to have Jimmy.
You have to have good data to start off with, and that's my mantra. Yeah.
Right. No, we agree with that. So Jimmy, we're delighted to have you on the faculty of AI Med Cardiology coming up on May 19th.
Mm-hmm.
Can you just give us a small preview of what you'll be talking about?
Well, the concepts that I've just articulated about the need for good data really is where my focus is. It's my interest. I would not qualify myself as a, if you will, card-carrying artificial intelligence person, but instead, I think I understand what needs to happen in order for those AI engines really to work. So I'm going to focus a little bit on the good data side, and that is, how do we change and transform healthcare in ways that allow us to capture information through the processes of care, utilizing the entirety of the healthcare team, while reducing the clinician burden, reducing the burden on an individual physician in service of putting together the data sets that are needed for machine learning and artificial intelligence, et cetera, actually to work well, to work efficiently, et cetera. In other words, I'm part of the trying to fix the garbage in problem so that we can all then be much better positioned and have good stuff coming out, not garbage out.
Well, Jimmy, thank you so much for being a great colleague and friend. And we look forward to seeing you at the AI Med Cardiology event on May 19th.
I'll be there.
Thank you.
See you then.